Dear students, today we are going to discuss about specimen collection, especially blood. Okay. So coming to introduction, so here we need to see that qualified and trained technical staff are backbone for implementation of quality management system in medical laboratory. Okay. So if you want to implement a quality management system in a laboratory, you need to have qualified and trained technical staff. Until unless you cannot implement quality management system in a laboratory. Okay. This point we should understand. And coming to in India, we have accreditation bodies which assesses medical laboratories for quality and technical competence. So once labs, we call them as a CAB, okay? So complied with ISO 15189 standard, accreditation body, whichever it may be, yeah, NABL is there or QA, recently we discussed about that, yeah, CAP, okay? These accreditation bodies assess laboratories with having a standard of 15189, and afterwards, if they found that compliance is there, so they award accreditation to medical laboratories, okay? So one of the requirement here, what is the requirement? Regular structured training and competence evaluation of lab technical officers is one of the prerequisites for laboratory accreditation. This point we should understand and we should keep in our minds, okay? So coming to the qualities of a laboratory technical officer, what are the qualities he should have? And he should be humble, polite, and second one is good communication skills. He has to communicate properly with patients, okay? And commitment to work. He should be regular to work and he should have a commitment, okay? And problem solving skills. He should have a problem solving skills. So there may occur errors in laboratory, you know? So once a problem arises, how to solve the problem? He should have some skills, okay? And he should be active and fast and as well as smart in work, okay? And a sense of responsibility. He should have a sense of responsibility. What is my responsibility? What is my job role here? Okay. And coming to follow instructions of supervisors, okay? Whoever supervisor is there, immediate supervisor, he should follow the guidelines, follow his orders, okay? And the eighth point is eager to learn new processes, etc. These are the few things a quality technical officer should have quality. Okay. So coming to general approach to the patient identification. How are you going to identify patient? If patient comes to a hospital, yeah, your laboratory, how are you going to identify? So there is some a few points are there. With that particular points, we can come to know that he is a patient and he needs some investigations get done at our laboratory. Okay. A general approach to patient identification is essential for ensuring patient safety. Not only in OPD, even in IPD also, inpatient departments also, we need to identify the patient first. So how are you going to approach? And why we need to identify the patient? Ensuring patient safety, okay, and preventing medical errors, okay. Here's a structured overview of how to properly identify a patient in a healthcare setting. One, use of two identifiers. Two identifiers we should use. Always use at least two identifiers before any procedure, treatment, or medication administration. Okay. So common identifiers include one is full name. We have to check his full name, date of birth, medical record number, MRN, or unique ID. UHID, we call it as in unique ID. Okay. Barcode on ID band scanned electronically. It may be good if hospital provides, yeah, laboratory provides. So note, do not use room number or bed number as identified. Sometimes patients may get few doctors, they change inter patients, they change one bed to another bed. Okay. So we should not identify by using the bed number or room numbers. Okay. We have to have a full name or a date of birth as identifiers. Okay. So, two, check ID band or bracelet. Ensure the patient is wearing a hospital identification band. Confirm the details on the ID band. Match the patient's records. Replace or correct the band immediately if it is missing or incorrect. So immediately you have to replace. Okay. This is identification requirement. Okay. So coming to third point, Act 2 patient involvement. Once the patient comes at phlebotomy section, ask the patient to state, not to just confirm their name and date of birth. You just have, for example, can you please tell me your full name and date of birth, please? So like this, you have to confirm his full name and date of birth so that you will get a clear idea he is a patient. Sometimes what will happen? Patient will come there, and with that patient, some attendant, yeah, some close relative will be there. Close relative will go and sit on phlebotomy chair, and he gives the sample because he don't know what's happening there, and he might be thinking that, oh, they are collecting my sample. Just simply he sits there and he gives his sample and he leave the place. Okay. So fourth point is cross check with medical records. Okay. Compare the patient's. So this activity we have to check in IP, inpatient department. Compare the patient's stated information with medical chart, lab requisition forms, medication administration records. All this we need to keep in our mind. Okay. So use technology when available. Use technology. It's a good thing, if there is a technology available, you can use like barcode scanning systems can reduce errors significantly. Biometric systems, example, fingerprint or facial recognition, or used in subjectives. Okay. So sixth thing is special considerations. How are you going to consider unconscious or confused patients? For those type of patients, use ID band and verify with family members or records. Okay. And coming to newborns also, how match ID bands with mothers, and double check all details. Okay. So coming to few patients, they have language barriers. So use interpreters when needed to verify identity. Okay. So all these points we should keep in mind. So coming to phlebotomy, phlebotomy means what? Phlebotomy is a place or area where samples are collected, like blood sample, a urine specimen, a stool specimen, whatever it may be. It is a separate area. Okay. Even we can call it as a phlebotomy for NABL side. If you take NABL, they say sample collection facility, SCF. Okay. We should remember all these points in our mind. So, what is a phlebotomy? Phlebotomy is the process of taking blood from a person. Okay. This is usually done using a needle to collect blood from a vein, most often in the arm. Okay. Why is it done? What is the necessity? What is the necessary? To test your blood in the lab, to check your health, sometimes to remove extra blood in certain medical conditions. What are those medical conditions? One condition is polycythemia. It is some medical condition. Their doctor may advise. So get it, remove extra blood, whatever it may be. Because some patients may have high hemoglobin percentage. That time they need to have this type of procedure. Okay. So who does it? Who is responsible for it? A person called phlebotomist, who is trained in collecting blood samples, in collecting blood. Okay. They are trained to draw blood safely and gently. So coming to phlebotomy area, before collection of blood, patient preparation and readiness is required. Counseling of patient for specimen collection. So how to counsel a patient? What are the points to be considered here? One is advise patient not to have alcohol. If a patient wants to give blood sample on particular date, for example, today is first, okay? After 3 days, he wants to give, and we can advise him not to have alcohol for 3 days and come to laboratory. So then he may come to laboratory because it may affect results. So second point, ask patient if he is on any medication. We have to confirm. Okay. So avoid exercise before sample collection. Ask patient to have balanced diet. For fasting sample, for example, if patient wants tested for fasting sample, we have to advise him to have a fasting sample and have a fasting for 12 to 14 hours, okay, prior sample collection. Not to have any tea, coffee, or juice, but he can have some water, okay. For postprandial, postprandial, advise patient to have breakfast and wait for 2 hours for sample collection. Report lab 15 minutes before the scheduled blood collection time. It is important. There also we have to check whether the patient is having breakfast and he has completed proper timings or not. Okay. So coming to requirements for specimen collection. So material name, I keeps on reading here. Just see here. One is tourniquet, first aid box, syringes of different sizes, 19, 20, 21 gauge, or vacuum system. If you are using vacuum system, there will be separate needles and holders will be provided, and absorbent cotton, disposable needle or lancet, spirit or isopropanol, sterile contents 50 ml and 100 ml size capacity, non-sterile clean containers 50 ml or 100 ml, needle disposable box, blood culture bottles. So one more thing is in a phlebotomy area, already you can see phlebotomy chair. Okay, separate chair will be there. That one should be there. It is better. So 12th point, red tubes for serum. So these tubings and all, no, we can study in order of draw also. There also you can come to know. Even in anticoagulant tubes, there also you can know about this. But here I will keep a few points here. Red tubes for serum, gel tubes for serum separation. Okay, SS means serum separating tube. SST also we can call them. Lavender EDTA. In EDTA also there are two types. One is sodium 2 and potassium 2. Yeah, K3 tubes also you can get it done. Why EDTA is used for whole blood, like investigations like CBP, complete blood picture, yeah, CBC, complete blood counts, even single parameters like total WBC count, yeah, total platelet counts, yeah, total RBC counts. For those investigations also, we need to have a EDTA sample. Okay. Blue sodium citrate, liquid whole blood for ESR and coagulation test. So here for ESR, no, sodium citrate samples are used, but few companies they are providing black color tubes. Okay, black cap tubes. Okay, so coming to green heparin plasma or whole blood, and gray sodium fluoride plasma for blood glucose. These are the tubes we should have in a phlebotomy area. Okay, so next coming to specimen collection. Specimen collection is a means taking a small sample from a person's body to test in a lab. Okay. These samples help doctors find out what's going on with your health. That's the main thing. So common types of specimens. What are the common types of specimens we collect in lab? One is blood taken with a needle. Another one is urine collected in a clean container. Stool, stool specimen, that is feces. Fecal material, okay, collected in a clean container. Sputum, mucus from lungs, usually spit into a container. Swabs taken from the throat, nose, wounds, etc. by a swab, okay. So what happens during phlebotomy? One, ask patient sit on sample collection chair or lie down as per patient condition, okay. So second, check TRF, test requisition form. Check labeling of tubes and containers. A band or tourniquet is tied around arm. And we need to have one point in our mind is remove within 2 minutes. If you are tying, if you are putting a tourniquet, no, within 2 minutes, you have to fulfill, yeah, you have to complete the task. Okay. Select vein site from arm, like median, cephalic, basilic veins are commonly available. So median cubital vein is ideal for blood collection. So most of laboratory technical staff, they use median cubital vein. Okay. So note, avoid healed burn sites and hematoma sites to avoid erroneous test results. Okay. So coming to next, how to choose right vein. Already I have discussed here. Median cubital vein, it is an ideal vein. If no, if sometimes if you want to collect from cephalic vein or basilic vein, no issues. But here the flow will be slow. Okay. So that those things we should have in our mind. Next, ask the patient to make a fist. He has to tightly had to make fist like this. And once the vein is selected for blood collection, the technical person must clean the collection site with spirit. That is, or 70% ethanol dry area, first dry area, without touching the skin. If he once again, if you touch the skin, what will happen? Again he has to clean that particular site. Okay. A needle with syringe or vacuum needle with holder is used to take the blood with holding 30 to 40 degrees angle. He has to maintain the angle also. So 9 point, once blood is drawn as per required amount, as per requirement, fist must be released and loose the tourniquet and remove it. Immediately cotton ball is kept on puncture site. Slowly remove the needle from vein and hold cotton to stop bleeding. Okay. Afterwards, a small bandage is placed on the spot. This this method is used to collect blood samples routinely. So it's usually quick and may feel like a small pinch. Okay. So order of drop, and this is the important thing we should remember in phlebotomy area. Okay. To avoid cross contamination, blood must be drawn and collected in tubes in a specific order. This is known as order of drop. So here you can see here blood culture tubes or vials. First, we need to use blood culture tubes or vials. Number two, second tube is coagulation tubes. That is blue top. Here in picture you can see here. Sterile one, number one. Number two is citrate. And serum tubes without clot activator or gel red top tubes. Okay. So here red cap or yellow cap tubes you can use. And fourth one is serum tubes with clot activator. That's what already we have discussed. Gel gold or tiger top tubes. Fifth one is heparin tubes. Okay, heparin tubes. In this diagram here, heparin shows fourth one, but here one more is missing. No issues. But here you can see serum tubes with clot activator or gel gold or tiger top tubes can be used in this third and fourth area. Okay. So fifth one, heparin tubes, green top tubes. Sixth one, EDTA tubes, lavender top tubes for CBC and all. And seventh one is oxalate or fluoride tubes, grey top tubes. This is an important thing we should remember in a phlebotomy area, how to collect sample and order of drop. Okay. So here one BD company is there. Those people, they supply a lot of test tubes, okay, like BD vacuotiners and all. They have this company material, okay. So here you can see here blood culture tubes, no, SPS. So this comes in first, and once you collected in particular tube, you have to mix it. You have to mix by inverting 8 to 10 times, okay. So coming to citrate tubes, 3 to 4 times you have to invert it. And coming to serum tube, 5 times at least. And coming to heparin, 8 to 10 times, you have to mix by inverting it. Okay. So EDT also 8 to 10 times. And fluoride also 8 to 10 times. This is a correct procedure to collect the blood sample and mix it. Okay. So why to collect specimens? To check for infections, to find out how organs are working, to help diagnose diseases. See, one is to check infections, any infections are there or not, to identify them, and to find out how organs are working. What about kidney? What about liver function test? What about pancreas? What about cardiac? All those organs, no, whether they are functioning properly or not. So we need to identify, and we can identify them by having a blood test. Okay. So general steps. Explain the procedure to the patient. Label the container with patient's name, date, and time. Collect the sample using clean and sterile tools. Store it properly. Some need to kept to cold temperature. Send it to lab quickly. Okay. Storage and transportation, transport and disposal. So coming to first storage, specimens like blood, urine, etc. are stored in clean labeled containers. Some samples need to be kept cold in a refrigerator or room temperature, depending on the test. Hazardous materials are stored in special biohazard container to avoid spills or contamination. So coming to next step is transportation. So there will be separate transportation boxes or bags available. Okay. So samples are transported in sealed leak-proof containers. They are placed in biohazard bags and labeled properly. Transport must be quick to prevent damage or spoilage. Some may require ice packs uh, for maintenance of temperature or special boxes during transport. Okay. So next, after collection, we need to go for next step, that is disposal. Medical waste like used needles, gloves, and contaminated materials must be thrown away safely. So biomedical waste management rules are there. So those rules and regulations we had to follow. Okay. Sharp objects go in sharp containers, hard puncture-proof boxes. Infectious waste goes in yellow or red biohazard bags. Waste is then sent for incineration, burning, or special treatment to kill germs. So goal, keep patients, healthcare workers, and environment safe. Okay, safety is important thing now, and we need to follow pollution control board guidelines up to date. Okay, we need to know whether in 2016 they have given some guidelines, and again they have keeps on updating. Okay, so here one biomedical waste management chart, if you see, this was downloaded from Jipmer biomedical waste segregation chart. So dispose waste in the appropriate disposal bin. Yellow, what we can dispose here? Human anatomical waste, blood-stained cotton pads, expired medicine, blood bags, masks, caps, fabric apron. So these are all the materials where we can discard in yellow bin. Even cotton. Once we collect the blood, no, that time we are going to use some cotton. Those type of cottons we have to discard in yellow bin. Coming to red container, a red bin. So IV sets and bottles, syringes. So here syringes are there. We have to discard in syringes in red container. ET tubes, Riles tubes, urinary catheters, gloves, plastic aprons, Euro bags, vacuum So vacuum we have to discard in a red container. Okay. So coming to black, food materials, this is general waste. Okay. And coming to blue, here used vials, all glass bottles, used ampoules and all, we need to dispose in a blue container. Coming to sharps, white content, okay? Like needles and suture needles, lancets and all, no, we need to discard in white content, okay? So next, same thing, it is, so needle mutilation. So how are you going to do needle mutilation? So I think previous we have shown here in this diagram. See, this is a needle cutter. There are different types of instruments where we can use for needle cutting and all. Needle cutting and syringe disposal also. Okay. So coming to anticoagulants, what are the anticoagulants we are using in laboratory? And definition of anticoagulant. Anticoagulants are medicines or chemicals that stop blood from clotting too quickly. Okay. They are also called blood thinners, even though they don't really make the blood thinner. Why are they used? To prevent blood clots, treat clotting problems, protect people who have had heart attacks, strokes, and blood clot diseases, okay, like DVT or pulmonary embolism. So these are the anticoagulant test tubes. You can see here EDTA and sodium citrate tubes are there. So these are a few anticoagulants we can see here. Today we are going to discuss about EDTA, heparin, sodium fluoride, citrate, double oxalate, and ACD, CPD, and all these anticoagulants we can see in blood banks. Okay. So common types in labs. These are added to blood collection tubes to prevent clotting before testing. Okay. One is EDTA, ethylene diamine tetraacetic acid, used for blood counts CBC. Already we discussed about this. Color of tube will be purple or lavender. Second tube is heparin tube, used for plasma test, especially chemistry. Color of tube is green. Okay. And citrate, used for clotting, coagulation tests like PT or APTT. Color of tube will be light blue. And coming to oxalate, often mixed with fluoride for glucose testing. Color of tube important is notes is oxalate will be gray color. Okay. So here each anticoagulant is used for specific test. Using the wrong one can affect the test result. Okay. So here first we are going to discuss about EDTA. An EDTA tube is a blood collection tube that contains the chemical EDTA, ethylene diamine tetraacetic acid. EDTA is an anticoagulant, which means it prevents the blood from clotting. Okay, main function of EDTA is to prevent blood from clotting. Tube color, purple or lavender top. Already we discussed. What is it used for? EDTA used for tests that need whole blood or blood cells to stay in their natural form. Common tests include CBC, complete blood count, blood typing, hemoglobin test, ESR, erythrocyte sedimentation rate. Again, ESR can be done in sodium citrate tube also. Okay. How does it work? EDTA works by binding to calcium in the blood. Calcium is needed for clotting. So when EDTA blocks it, clotting cannot happen. The simple definition is EDTA works by binding to calcium in the blood. Calcium is needed for clotting. So when EDTA blocks it, clotting cannot happen. Clotting cannot happen. So coming to dipotassium salts of EDTA. So already we discussed K2, K3 like this, no? So dipotassium EDTA, also written as K2 EDTA, is a salt form of EDTA used as an anticoagulant to stop blood from clotting when it's collected for lab test. Where is it used? Found in purple lavender top tubes, mainly used for hematology tests like CBC, already we discussed, and even blood smears also we can get it done. So how does it work? K2 EDTA works by binding to calcium again in the blood, since calcium is needed for clotting. So why K2 EDTA? It gives accurate blood cell counts. It keeps red and white blood cells in good condition. It's less likely to shrink red blood cells compared to other types. Okay. Other forms of EDTLs also is there K3 EDTA, tripotassium EDTA. Liquid form sometimes causes cell shrinkage. So that's why better to use K2 EDTA. So sodium EDTA, disodium EDTA, less common in blood collection. So one more anticoagulant, that is sodium citrate. Sodium citrate is an anticoagulant, a chemical added to blood collection tubes to prevent clotting. How does it work? It works by binding to calcium in blood. since calcium is needed for clotting. Again, here, same function. EDT also same function and same sodium citrate also. Okay. So, but these two anticoagulants are different. One is EDTA, ethylene diamine tetraacetic acid, and one is sodium citrate. Okay. So tube color will be light blue top. What is it used for? Sodium citrate is mainly used for coagulation, clotting test, coagulation studies, okay? Like PT, prothrombin time, and APTT, activated partial thromboplastin time, INR, and D-dimer. These tests check how well your blood clots are there, okay? So coming to sodium fluoride. Sodium fluoride is a chemical used in blood collection tubes to preserve glucose, sugar in the blood. It is not an anticoagulant by itself, but it is often combined with an anticoagulant like potassium oxalate. Tube color will be gray top. What does it do? Stops glucose from breaking down in the blood after collection. So normally what will happen? If you collect blood glucose sample in a red color tube, yeah, yellow color tube, no? Yellow color sometimes it's okay, but coming to red color tube. So there blood glucose level will be slowly coming to decrease. Okay. So like hourly basis, 1 hour, within 1 hour or 2 hours, minimum 5%. For example, a patient is having 100 mg per dl. After 1 hour or 2 hours, he may reduce like 90, like 5 mg per dl. Like how much value we will get? 95 or 90 like this. Okay. So better to avoid such thing, no, we can use sodium fluoride also. So great top tubes, what does it do? Stops glucose from breaking down in the blood after collection. Helps gives accurate blood sugar levels. Even if the sample is tested hours later, common uses blood glucose testing and lactic acid test. So again here single oxalate is there, and single oxalate refers to using only one type of oxalate salt as an anticoagulant in blood collection. The most commonly used one is potassium oxalate. How does it work? Potassium oxalate works by removing calcium from blood. Again, same thing. Calcium is necessary. We already discussed in previous slides. So used in gray top tubes. Glucose, again, it is for glucose testing. Some older hematology tests also we can perform. And here double oxalate tube is there available. Double oxalate is a mixture of two chemicals used as an anticoagulant to prevent blood clotting during sample collection. It usually contains potassium oxalate and ammonium oxalate. These two balance each other to protect red blood cells and keep blood sample usable. It works by removing calcium from blood. Same thing. So again, this is used for glucose testing, some hematology investigations. Okay. So coming to heparin. Heparin is an anticoagulant, a chemical added to blood collection tubes to prevent clotting. How does it work? Heparin works by blocking thrombin. Here, it is not blocking calcium. It is directly functioning on thrombin. Okay. An enzyme that helps in forming blood clots. Tube color will be green top. Types of heparin used. One is lithium heparin, most commonly used. And second one is sodium heparin. Okay. So third one is ammonium heparin. What is it used for? Heparin is used for tests that need plasma, especially in clinical chemistry investigations, and blood gases. If it is collected in syringe, okay. So main function of heparin is to block thrombin, okay, and where it is used, one is in clinical chemistry investigations as well as in blood gases if it is collected in syringe, okay. So commonly after collection, here one thing we should keep in mind is important thing we should remember is in lab quality management process, we have three phases. One is pre-examination phase. Already we discussed it. Sample collection process comes in pre-examination phase. And second one is examination phase. And third one is post-examination phase. Three phases are there. So here you can see what is pre-analytical phase. Pre-analytical phase, a pre-examination phase, a pre-testing phase, three are same. Okay. So first, patient goes to the physician, and physician needs diagnosis. So he may think of few diseases, whatever it may be, abnormalities in patient, and he orders investigations. Okay. So once the patient reaches to collection center, phlebotomist counsel patient, and after getting counseled, next step is billing, and after that sample will be collected, and this will be sent to the by identifying by labeling and all. No, we can send it to transportation method, sent to the laboratory main lab. So here they prepare the sample and they analyze the sample. This is analytical phase, and after that they report the results. Here interpretation, again it goes to physician. Okay. This is how a laboratory management system works. Okay. So here one thing I want to raise concern is most of the errors occurs in pre-analytical, that is pre-examination phase. Here you can see the percentage. 62 to 76 percentage of errors are noted in pre-examination phase. And coming to analytical phase, only 6 to 15%. Okay. So less number of errors are occurring in examination phase. And coming to post-examination, again, here also more 18 to 30%. Okay. We should be very careful in these two areas. One is analytical and post-analytical. Okay. So common errors in blood sample collection include hemolysis, breaking down of red blood cells during the collection process, causing a pink or red tinged sample. And second is clotted sample, blood clotting within the collection tube, preventing proper analysis. Insufficient sample volume, incorrect identification, wrong tube type, incorrect timing, prolonged tourniquet time, drawing blood from IV catheter. In hospitals, most of staff, they collect sample from the IV catheter. This can introduce fluids and additives from the IV line into the sample, and it will affect results. Poor technique, using a needle that is too small or large, can causing damage to blood vessels. Using excessive force when drawing blood. So contamination, introducing bacteria or other contaminants into the sample which can interfere with the analysis. Consequences of pre-analytical errors. Delayed processing, leaving the sample at room temperature for too long, which can degrade certain analytes. Inaccurate lab results, leading to misdiagnosis, inappropriate treatment, and unnecessary medical interventions. Okay, unnecessary medical treatment, okay, will be provided by the physician. So here 70% of the decisions by physicians are made by lab results. Okay. So delayed diagnosis. If errors require repeated testing, diagnosis can be delayed, potentially impacting patient outcomes. Increased healthcare cost and repeat testing and potential complications from inaccurate results can increase cost for both patients and healthcare systems. And finally is patient harm. Inaccurate results can lead to inappropriate medical decisions, potentially causing harm to patients. So with this one flow chart you can see here, patient entry and visits to doctor. This is and all no pre-examination phase, and here examination phase and post-examination phase. Okay, thank you.